Hello, my name is Jim Hemingway. This is my final paper and review of my topic. The topic of choice was the Baylor Scott and White merger. I'll be acting as somewhat of a consultant through this paper, giving you my ideas and kind of giving you a snapshot of this merger and what happened. This is for Tom Edwards, Business 7000, Organizational Behavior. So on October 1st, 2013, the Baylor Scott and White healthcare merger was happened and is created. This was the largest healthcare merger in the state of Texas and one of the largest in the United States. Um, it took about a year and a half or so for the whole merger to take place. One of the biggest things that came about was that it makes the largest footprint of a healthcare system at a not-for-profit level in the state of Texas. This is a good thing and it's a bad thing. Bad thing is that we now have gained more competition and have more of a view at the government level on how we operate and what we do. So, that being said, this merger when it happened, uh, the healthcare system grew to 46 hospitals. It has over 500 patient access points. That includes family practice offices, urgent care centers, diagnostic imaging centers, etc. It gained over 6,000 physicians and then over 36,000 employees, which is crazy unheard of. And we are growing day by day. One of the biggest challenges for this organization throughout the merger was we, as a healthcare system, did not know the financials because of the FTC rules and the government rules regarding merger. So you can't cherry pick or decide who you want to merge with because of profitability. Uh, so throughout this whole merger process, we didn't know as the Baylor healthcare system what the Scott and White financials looked like, and vice versa. The Scott and White folks didn't know what the Baylor financials looked like. It was just assumed that Baylor had a pretty good financial standpoint. And as far as Baylor knew, Scott and White was a pretty reputable organization with some of the same moral values. We're going down the same path as what the Baylor healthcare system was. So it looked like it was going to be kind of a perfect marriage. But as we all know, marriages have their ups and they have their downs. So with the FTC and the government scrutiny along the way, the merger just took a little bit longer um, to happen. So all that being said, I was fortunate enough to sit down with the CEO of Baylor, now the CEO of Baylor, Scott and White, and have an interview with him and essentially pick his brain. And he said the most frustrating time of the merger was the testifying in front of Congress and the FTC about why this merger needed to take place, why we needed to be the largest footprint in the state of Texas. And and he tried to explain for the Scott and White healthcare system and the Baylor healthcare system to succeed and give safe, quality, compassionate care, that this merger did need to take place with the Affordable Health Care Act and all the provisions that are involved in that act. It really has narrowed the field per se on access points and being able to create an accountable care organization and to be able to link physician to hospital, hospital to patient, patient to physician, and have that circle of information come back to the facilities. So what Joel Allison's vision was is to create the healthcare of the future. Throughout that run, really the Baylor name has a large presence in the state of Texas and somewhat throughout the United States. Scott and White really has a great name in Central Texas. It's a very well-known facility, and the brand recognition of the two facilities they thought was going to help them with the future. So what they did find out though along the way was it wasn't just about brand. It was so much more. It was about quality. It was about being able to gain a footprint and have people have access to affordable health care. And through this process, what was happening was the Walmarts, the Walgreens, the CVSs were coming up with minute clinics and taking some of that good business that the hospitals need to survive away and making it more accessible to the patients. So through that venture, what ended up happening was the leaders of Baylor Scott and White saw what was going on and now needed to focus on how do we reach this population? How do we reach these patients? How do we work together with the Walmarts, the Walgreens, the CVSs to provide that level of service and level of care that the patients do need? So along the way, the Baylor Quality Alliance was formed, and the Scott and White Healthcare Plan had already been, in fact, grown. Now it was trying to combine those two entities and be able to go out to the public to give them that great access to healthcare. But here again, they spent a lot of time on branding their name and you trying to make themselves the mogul because of who they were and what their name was, instead of focusing on these details of accessible, fast, quick healthcare. That was one of the main things that I pick on with this merger. Secondly, one of the biggest things that I think is the most heavily scrutinized is the physician model. So Baylor healthcare system as a whole does not employ physicians. They have an entity that has physicians called Health Texas Network. That is, they are employed physicians, but Baylor does not mandate that their physicians are employed at their facilities. They let individual practitioners and individual groups into their facilities to practice medicine. The flip side to that is the Scott and White healthcare system. All of their physicians are employed. They are a piece of the hospital. Their quality metrics are measured. Their data metrics are measured. Their patient satisfaction is measured, just like the employee satisfaction, and their physician satisfaction is measured as well. So those physicians are therefore integrated in the hospital. Sometime back, Baylor decided that that wasn't the way they wanted to go because of violations of Stark Law, and Stark Law becomes a big piece to this puzzle because Stark Law works either way, employed or not employed. There were two examples in my paper where the employed physician was overpaid and not paid to market and was being paid to funnel patients in, and that case was lost. And that's Baylor did not want to get into that business. But the Scott and White model works very well because in Central Texas, there's not much down there per se. The areas that these facilities sit in are the only arenas for healthcare in the area. So the patients really don't have a choice to go or not to go to Scott and White. They would have to drive miles and miles and miles away to go to the nearest facility. So funneling patients wasn't that big of a deal. One of the biggest deals that Baylor had encompassed over the time with Stark is that physicians were, especially the orthopedic physicians, and this was stopped, were bringing in implants that company that they worked with, they were invested in. The attorneys got a hold of that and they looked at that and compliance got involved, and that looked as if they were funneling patients to our facilities because they were able to use an implant that was a company that they were invested in. So that got nixed, which hurt Baylor because orthopedic volume is good volume. It's high paying volume in most cases. But Baylor, being patient friendly and savvy, said, you are paying more for a device that is being implanted that does the same thing as the device that's under contract with us. And Baylor thought that they were doing a disservice to the patient. So, and not only that, they really looked at the kickback and was that a Stark violation or could it potentially be perceived as a Stark violation? And so they stepped away from that. And then the final topic in my paper was employee engagement and how the employee has succession planning going through. Baylor as a whole has a plan in place for succession planning. They call it the leadership journey portal. Through team leader all the way to CEO, there is a leadership journey or path of classes, of exercises, of meetings happen to inform that team lead, supervisor, director, VP, CEO on where they need to be going and what they need to be doing. One of the downplays is that the Scott and White healthcare system had nothing like this. What we did find out after the merger had been acknowledged and completed is that Scott and White was not in the best financial situations. In fact, we found out that their employees hadn't had raises in multiple years and or cost of living increases, so on. So if you were a brand new hire employee 3 years ago, you're being paid the same rate as a new hire 3 years prior to that, which their employee engagement and satisfaction was very, very low. We found that out later in the game. So succession planning became a big part, and employee engagement became a big part in what happened after the merger. Criticisms there is Baylor could have been prepared for something like this, and so should a Scott and White, knowing that there were going to be multiple positions and fluff at the top and in the middle that had been could have been eliminated, and that money saved could have afforded raises right away out of the chute for these employees. Assumed the worst, but it was not assumed. So it took about a year and a quarter for raises and cost of living increases to come to those groups down there, as slowly those fluff was removed and slowly monies earned was put into a kitty to be able to give those raises as needed. One of the other deterrents, and should have been thought about prior to, is Baylor was very structured and very standardized throughout their hospitals and how they cared for patients. For example, I personally am the director of cardiopulmonary and cardiovascular. We have a council that meets, and it's all the managers and directors, and we standardize policy and procedures. We standardize how work gets done. We come to the table with solutions and ideas on how to make things better. Scott and White, however, did not have this, and it was perceived as a threat when the companies merged because the succession planning wasn't in place. Employee satisfaction was at its lowest, and had we prepped for that, it could have made things move so much faster and made us come together so much quicker. Still to this day, we're 3 years into it, and we're just now getting to the point to where we're talking and everybody's comfortable. The politics don't feel like they're there, and nobody feels as if their jobs are threatened. Prior to this, jobs definitely felt threatened, and people didn't like to be told what to do down in the southern region, and that's essentially how the councils were perceived, because we were so conjoined in doing the same thing that when we presented ourselves to them, it was very seemed very authoritative, and this, you're making us do this. We've never done this, because they had worked at such individual levels as facilities to where the Baylor healthcare system was working as one. But 3 years later, the snapshot is we're all working together. And to sum it up, it's probably going to be one of the best healthcare organizations in the United States to be part of. Things that have happened since we have a partnership with the Cleveland Clinic for our cardiovascular programs. We are in multiple conversations with healthcare systems around the state and around Arkansas, Oklahoma, and New Mexico that want to be part of our Baylor Quality Alliance. We want to be the Affordable Care Act the best of the best, I guess. That was a long pause. I apologize. Accountable care organization is where we strive to be. We want to lead the nation in saying, this is how you take care of patients. This is how you work as a large organization and do it cost effective for the patient, first and foremost, and do it cost effective for the healthcare systems at hand. I thank you for letting me to share my paper with you and to share our organization with you. It is near and dear to my heart, and I enjoyed this class thoroughly. I thank you for a great class.